Well, it's a beautiful day, but you know what? The Bills know what a difference a day makes when it comes to our smiles. And so does Dr. Todd Shatkin. He and the experts at the Aesthetic Associate Center can truly make you proud of your smile and in a shorter time than you ever thought possible. Dr. Shatkin is here with some pictures, and they are astounding, of people who, I guess, had missing teeth, and it's what you can do to fill those gaps and give them a gorgeous smile in as little as just a couple of visits.
Well, hopefully the Bills will keep everybody smiling in Western New York, and I can keep making people smile beautiful.
I hope so, because I think it's going to be a great year for that.
I think so.
Yeah, so don't be embarrassed about your smile. Go and visit the dentist and go and see what you can do. And with implants, it's amazing what you can do.
Well, you know, we combine, a lot of times we can combine porcelain veneers with implants, or, you know, porcelain crowns and all different things, because we do everything, you know, to make people have beautiful smiles.
Yeah, all right, shall we have a look? Let's have a look at the first one, and you can show us what you were dealing with this first time out. Let's go to the first picture. Okay.
This is a young boy who had congenitally missing teeth. He was missing his lateral incisor teeth, and 14 years old, and we placed 2 mini implants to replace the 2 missing teeth. You can see the next picture.
And you can do that at 14.
And then we put the crowns in right away in the same visit, and I gave him a, you know, when you're 14, it's a very important age, maybe more so for girls, but guys too, to look their best, to feel their best in school. And when you walk around with spaces in your teeth, it can be an effect on your self-esteem.
Now, would they ever have to be removed and changed as he got older?
It's possible, but you know, we just keep an eye on things. And with the mini implants, it's such a minimally invasive procedure that if you have to do something down the road, it's not a big deal.
That's amazing. He's 14, and it just that was it, one procedure, and he's done. Isn't that great?
Now he's 15, and you know,
and
a year later, and still smiling, happy.
Wow, let's check another one. Let's go to a before. And by the way, our phones are open for Dr. Shatkin at 644-9840.
Here's another example of a young person missing a lateral incisor. Again, you can see on the right side of that picture is the retainer. The patient had a removable plastic retainer to replace that tooth, was tired of wearing a removable tooth.
Oh, yeah.
And of course, here's the implant. You can see the little mini implant screwed in the bone. And this is done without any incisions, without any cutting of the gum, no surgery. And it's really not uncomfortable at all for the patient, and we can put the crown on immediately.
And now he doesn't have to wear that plastic thing in his mouth anymore. Wow, how nice to be able to free people from that.
They don't have to take the tooth out and put it in and worry about leaving it on their lunch tray or next to the bed, or forgetting it, or breaking it, or whatever.
And you can even do that for people with dentures who who would rather not have that artificial palate in their mouth.
Right, we can do it for we can do it from 1 tooth up to a complete set of teeth. You can put the implants in permanently.
Okay, we have patient number 3. Again, equally impressive.
This is an older, an adult, I should say, and missing a first molar. This was lost because of tooth decay. So the tooth was taken out and allowed time to heal. In this case, we put 2 mini implants in because molars need extra support, and then we put the crown on top of that. And there's the tooth in place. And again, this is the procedure that I developed, where you can place the implant and the crown in one visit. We now have several thousand dentists around the country using this procedure to replace missing teeth.
And that tooth looks so absolutely natural. You know, even the shade of the tooth, everything. And of course, with the 2 mini implants in there, that person's going to be able to chew on that tooth too. It's going to be a real functioning tooth.
Very strong. Oh, yeah. And one of the things I should mention is the laboratory is right in our building. So all the you mentioned the shade and the color. If for some reason something doesn't look perfect in the mouth, we just run it back upstairs, have our laboratory modify the color or the shape, and then finish it 15, 20 minutes later.
I'm so impressed that you can do this with, like you say, young people in their teens. So many times through an injury, maybe sports, they get a tooth knocked out and they're thinking, this is it, you know, until I get to a certain age, I'm going to live with this for a while.
And it's important to wear mouth guards in those sports. And I see so many kids out there, you know, with the mouth guard sticking out of their mouth and not really wearing it properly, or they don't have them at all. And the referees are supposed to say, you know, go get your mouth guard, but they don't always do that.
Well, you know, the sport I worry about, and that's the skateboarders.
Yeah.
I see some tremendous kids taking risks.
More injuries happen just at home on your bikes or skateboards or rollerblades and stuff. That happens more than even an organized sport.
All right, I think we have a phone call for you.
Sure.
Hi, good morning. Hi, who's on the phone? Yes, who is this?
This is Paula from Hamburg.
Okay, go ahead, please.
Hi.
Hi, how are you?
Good. How can I help?
Okay, I recently had a wisdom tooth pulled.
Wisdom tooth.
And I wanted to put an implant in there, but they had told me that I couldn't because my sinuses were too close to my teeth area.
Well, if it's truly a wisdom tooth, we really don't replace wisdom teeth with implants if it's your last molar. If it's a first molar or a bicuspid tooth, oftentimes we will replace those with implants, but it does depend on the position of the sinus cavity, how much bone you have.
Yeah, because, you know, a lot of times you have the wisdom teeth removed because there's no room to begin with.
Right.
So you really don't want to put something else back in that spot.
But it's possible that might have been one of your molars rather than your wisdom tooth.
I don't know if that person is still there, but...
And sometimes people get confused, but normally we don't replace third molars, which is the wisdom tooth. With
I'm assuming she means an upper if it's the sinus.
Yeah.
And you can see that in an x-ray, right?
Yes, you can see the sinus cavity on the proper x-rays, and we can plan. But what's interesting with the mini implants, oftentimes, even if it looks like the sinus is coming down, there's bone to the palatal and to the buccal or the cheek side of the sinus, because you're only looking at a one dimension of a three-dimensional object when you're looking at an x-ray.
Okay.
And we can oftentimes sneak those implants around the sinus
So maybe
cavity.
she should come in.
Sure.
Come in for a second opinion.
Sure.
Why not? Another phone call for Dr. Shatkin. Hello.
Yes, this is Joe from Tonawanda.
Yes, Joe.
What my question is concerning, tomorrow I'm having some lateral incisors extracted. There's a significant amount of bone loss. What can I do about implants? What do we do?
Well, if there's a lot of bone loss, Joe, you may need to have a bone graft put in there. It depends on how badly the bone is lost. And, but oftentimes just waiting and giving your body time to heal, that bone will fill in where the teeth were extracted. So it's just a matter of, you know, taking a look at the x-ray. I'm not seeing you as a patient at this point, but if you want to come in for a complimentary consultation, I'd be happy to see you and give you my opinion.
And you know, I don't want people to get crazed when they hear bone graft. I had a bone graft once, no big deal.
Yeah.
Just like any other dental procedure.
Yeah, we take bone, basically, it's either freeze-dried bone in a bottle, it's powdered bone, or synthetic bone, and then we just pack that into the socket, and that helps to cause faster healing. But it's not always necessary either.
Okay, there we go. If we have any more calls, we'll take them at 644-9840, and I believe we do have somebody online. Hello.
Hello.
Hi, go ahead, please.
Hi, this is Rose.
Hi, Rose.
Hi.
Go ahead, Rose.
With the implants, can you go through an MRI?
Yes, yes, but you do need to mention to the hospital that you're having, or wherever you're having the MRI done, that you have dental implants. They're titanium screws, and they won't cause a problem. But anything removable would need to come out. Like if it's a removable denture that snaps on, because there are the metal housings in those, you'd have to take that out before having the MRI.
And usually those people at the hospital are pretty good at asking.
Yes.
About everything that you might have in you.
Right.
It could be metal, so don't be afraid about that. Well, this is great. Obviously, a lot of people had some questions today.
Yeah.
Those pictures, as I said, were very impressive.
And if anyone, like I said, if anyone has any questions, they can call me at the office, they can call our staff, or you can come in for a complimentary consultation just by making an appointment.
Can't beat that, and with the way the Bills and the Sabres are going, we're going to be doing a lot of smiling this year. All right. Make sure yours looks the best it can. Go visit Dr. Todd and his wonderful experts at the Associates Center, and give them a call at 839-1700. They're very conveniently located at 2500 Kensington Avenue, the Aesthetic Associates Center. We'll be right back.